Hi, my name is Rachel Laver. I am a senior human development and family sciences major with a speech and language pathology minor, and today I will be talking about vocal fold paralysis. We're going to give a definition of vocal fold paralysis. We're going to look at some of the things about it, like the causes, symptoms, and treatment. I do have some videos included, but there's not enough time to show them, so they're in there just in case anyone wants to go and look at them. But we're going to look at an example of phonation and respiration with normal without the paralysis, with unilateral paralysis, and with bilateral paralysis. And we're going to look at what it affects, like breath, phonation, and voicing, and swallowing. So what is vocal fold paralysis? That is when one or both of the vocal folds / cords in the larynx are no longer able to move. Bilateral means neither side is able to move, and unilateral is when only one side, either the left or right, is no longer able to move. Some of the causes of vocal fold paralysis can be from surgery, because injuries can happen during surgery near your vocal cords, including surgeries to the thyroid gland, the esophagus, the neck, and the upper chest. It can cause damage to the nerves that are interconnected to the larynx, or also known as your voice box. Another cause can be injury to the neck or upper chest, either through an accident or, like mentioned before, surgeries. Another cause is stroke, and the blood flow to the brain is interrupted, which may result in damages to the part of the brain that sends messages to the larynx to phonate. Tumors are another cause. Any type of tumor may grow on the muscle, cartilage, or nerves that serve and control the larynx. Inflammation from infections like Lyme's disease, Epstein-Barr virus, and herpes, and the last cause can be neurological impacts from things like multiple sclerosis and Parkinson's disease. So, some of the symptoms of vocal fold paralysis can be a loss of loudness, loss of pitch, a breathy voice, coughing or choking while swallowing food, drinks, or saliva, hoarseness of the voice, needing to take breaths frequently while speaking, ineffective coughing, a loss of a gag reflex, and frequently needing to clear the throat. And a lot of these impact the just overall enjoyment of life that a lot of these patients have, because of course you're having troubles with speaking and swallowing and eating and breathing, so it's very impactful on patients. So, treatment of vocal fold paralysis, for specifically bilateral vocal fold paralysis, it would require medical treatment or surgery like a tracheotomy, and you also may need to surgically remove or move one or both of the vocal folds closer to the middle to ensure that the person can safely eat and sometimes safely breathe, because if they're having troubles breathing, obviously that could lead to a lot of problems. For unilateral vocal fold paralysis, they also may need medical treatment or surgery. For example, a muscle nerve transplant the paralyzed vocal folds closer to the middle, and they can also get an injection in one of their vocal folds to make that paralyzed vocal fold larger. Lastly, voice therapy with speech-language pathologists is very helpful because they can help patients change the pitch and get more breath support for louder speech. So looking at this picture on this slide, you can see in the top row, that's respiration, and the top left picture is what your vocal folds should look like without paralysis. And then the next picture to the right is what it would look like with unilateral paralysis, where one of the sides is paralyzed and can't move. And then in the last one, both sides are paralyzed, and you can see that they are a lot closer together than they should be in the original picture without paralysis. And then on the bottom, we have what phonation should look like without paralysis. So clearly the vocal folds are pressed together, which allows that vibrating, which allows for phonation. And in unilateral paralysis, you can see the right side is paralyzed, so it's not coming to the middle, which doesn't allow the vocal folds to come together to make that vibration for the phonation. And then in the last one, both are paralyzed and they're together, but they're still not going to have that strong of a vibration as they are paralyzed. So while looking at the effects of breath specifically with vocal fold paralysis, a patient may have a breathy voice, or they may run out of air quickly and frequently while speaking. When we are breathing quietly, our vocal folds are supposed to be open, which is not always the case with vocal fold paralysis, which you can see back in this picture. In the top row, on the right specifically, the bilateral paralysis, our vocal folds are supposed to be a lot more open, and those are pretty close together, which is not good. So vocal fold paralysis can lead to a person sounding hoarse and breathing frequently, or it can be to the extreme of life-threatening loss of breath, because obviously we need to breathe to live, and if a patient can't get in enough air, just in general or while speaking, that can lead to life-threatening loss of breath. And research has found that the result of air escape is the cause of respiratory dysfunction involving a lack of breath control and respiration from this vocal fold paralysis. And you can see over here in this picture just a close-up of the larynx, which I'm sure we have all seen many times before, but there again is what the vocal folds should look like when open for breathing. So, how is this related to physics? All sound involves the concept of pressure, and pressure is force divided by the cross-sectional area. With vocal fold paralysis, if the vocal folds are not able to adduct or come closer together, then the force of the sound waves decreases while the area stays the same, which in turn decreases the pressure of the voice sound and changes the way it is resonated and perceived because of the change of compression and rarefactions. So basically that's just explaining why the intensity of the voice is not as strong, because the pressure changes because of the change of the force on the vocal folds. In other words, it impacts intensity, pitch, and our vocal tract as a column, turning it from open on one end and closed on the other to sometimes both ends being open. Looking at phonation with vocal fold paralysis, voice tones require the vibration of the vocal folds, which cannot occur if one or both of the vocal folds are paralyzed, which we also saw back in that picture. Voiceless phonemes can still be made, but projection is still an obstacle. So those voiceless phonemes can be made, and so can the voiced phonemes, because we did see in the bilateral paralysis that the vocal folds are sometimes still close together, but the projection is not going to be there. Other factors affected include speech rate, pause time, consonant duration, vowel duration, and voice onset time, among other factors. So clearly that is going to impact how someone is able to speak. And the impact on the vocal folds comes from the glottal air leak and asymmetrical shape of the two vocal folds. And this changes the aerodynamic effects, which also reduces the ability and efficiency of the larynx. So if the larynx is not doing what it's supposed to do and it's not doing it efficiently, that is also going to decrease the vocal intensity, but it's also going to increase the amount of breaths needed to be taken, and it's going to cause you to have to put in a lot more vocal effort to have speech, which is going to be decreased in intensity. So, how is this related to physics? This specifically really ties into the source filter theory, because our vocal tracts act similar to the air column with one closed end and one open end. And the larynx acts as a weak source with the glottal pulses that aren't actually heard, which is the definition of source filter theory. And the vocal tract above the glottis acts as an amplifier and a filter. So together, the source and the filter make the output sound that we hear. But when the tract changes from one side being open and the other side being closed to both sides being open because of the vocal fold paralysis, then this source is no longer as strong, but the filter isn't changed. So that does impact the intensity of the sounds we are able to create, which we have already discussed. And here we have, I put in an example of what an open air column with a closed, so one open side, one closed side. This is similar to how our vocal tract functions. So our last concept is swallowing, and our vocal folds are supposed to be completely closed while swallowing because we do not want food or drinks or our saliva to go into our larynx and into our trachea, because that is used for breathing, not for food and other substances like that. So someone who experiences vocal fold paralysis may not be able to completely close their vocal folds, which we did see earlier on that picture as well. And like I said, this would allow food, water, and saliva to enter the larynx and trachea, which in turn can lead to coughing and choking. Research has shown that improvements in swallowing after therapy can be seen for total populations and not for specific ages, sex, or etc., which means this is good because we can work with patients and of all demographics and help them improve their swallowing. And we have seen that glottal gaps are diagnosed in 20 to 38% of elderly men and 70 to 90% of elderly women. And also, patients who have had intubation that are over 70 years of age are 3.9 times more likely to be diagnosed with unilateral vocal fold paralysis. So we have to be careful of that older age group. So, looking at how swallowing is related to physics, we can see that the glottal gaps occur during vocal fold paralysis, and that impacts our ability to swallow. And the glottal gaps occurring from vocal fold paralysis negatively change glottal pulses as the weak source, which is never actually heard until resonated, and impacts not only swallowing but the source filter theory. So swallowing with the glottal gaps is really important because those glottal gaps is what is our source in the source filter theory, and if those are impacted, then our whole process of speaking, breathing, swallowing is going to be impacted as well. And these are my references, and thank you for listening.